Hello, everyone, and welcome to another episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade, and I'm a naturopathic doctor. And today I am joined by Dr. Jen Pfleghaar. I hope I'm pronouncing her last name correctly. Dr. Jen, she goes by the handle on Instagram of the Integrative, or just Integrative Doctor Mom. That's Integrative DR Mom. And I've been following Dr. Jen on Instagram for a little while now, and she just has a lot of interesting posts, things to do with peptide therapy, the carnivore diet, hormone balancing, a lot of things around perimenopause. And I thought she'd be a really interesting guest to have on the podcast, and she was willing to chat with me. So I'm looking forward to picking her brain about some of those topics. These are all topics that, some of them maybe relate a little bit more directly to complex chronic illness, like say maybe peptide therapies or peptide therapy or the carnivore diet. But then a lot of folks who are dealing with complex chronic illness are also dealing with issues around perimenopause as well. And sometimes those are symptoms that we need to work on. So anyways, lots of the questions I want to pick Dr. Jen's brain about. And I'm looking forward to our chat. So I'm going to pause the conversation and I'll be back in just a moment with Dr. Jen. All right, everyone. Well, welcome back to the episode. I'm now joined by Dr. Jen. Dr. Jen, thanks so much for joining me today.
Hi, thank you, Brian. Thanks for having me here.
My pleasure. I have lots of questions to pick your brain on, but would you mind just giving the audience a quick little overview of who you are and what you do, and just get us acquainted with you, please?
Yes, absolutely. So, first of all, I'm a wife and a mother. I have four children, older daughter, and then three very active boys. And anyone out there with three boys, as you know, Brian, they're just very active. So we recently moved to Middle Tennessee. We're outside of Nashville, and we have a mini farm. We're trying to, raise chickens, and we'll probably have some mini beef cows and maybe a fluffy cow. We'll see. And my background is in conventional medicine. And I went to medical school. I wanted to be a DO. I met a DO in undergrad, and she was so cool. I actually met her in a gospel choir class, and she told me how DOs thought that the body was all a whole and that structure and function were related, and really looked at the body differently. So I went to DO school. I learned a lot about OMT, osteomanipulative therapy and medicine. And when it came down to it, though, it was still, we had to take these tests. We were still groomed by, big pharma, I would say, looking back at it. And we still looked at a complaint and a disease and a medication. And it was a little bit better than, say, MD school, in my opinion, but it was still not looking at root cause medicine. So I went to emergency medicine residency. I was working in a local ER straight out of residency. Loved it. Really enjoyed that emergency room. It was a level 2 trauma center, but I was seeing the same patients over and over again. I remember this one patient literally had 10 CTs a year she would get of her abdomen because she would have abdominal pain. So I sat down with her. I'm like, come on, like, this is going to give you cancer, getting all these CT scans. She was following up with her doctor, but I started talking to her about her diet and her sleep. And I went back from work that day and I told my husband, I'm like, I have to go back and do an integrative medicine fellowship. I read about this stuff. I love reading. I was getting, into Lyme and connecting that to all the dots of chronic disease. I was looking at gluten and how it affected our diet and inflammation and our gut health. And I went back and did a fellowship in integrative medicine. And that's where I'm at now. Had a brick and mortar practice for 8 years, serving the community as an integrative medicine doctor. And now I serve people virtually. So I see patients virtually now, and we moved down to Tennessee from Ohio. So that's a little bit about me. I'm very passionate about medical freedom and women's hormones also.
Awesome. Well, that's a great backstory, and it's wonderful. We're just always trying to help folks as much as we can, and that sounds like a really great path forward. Um, I want to ask you about hormones. Maybe since you mentioned hormones, I'll segue into that. I have a few other topics I wanted to chat with you about. Just before I get into any other questions, though, I'll just quickly remind folks, like with every episode of this podcast, nothing that we're saying should be construed as medical advice. This is all for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So as far as the hormone piece goes, I know you have a book that is on the way about perimenopause, and you have some interesting social media posts on Instagram, which is where I follow you, kind of talking about several different things, like around some interesting posts about being careful who you work with, like making sure the person who's advising you on hormones actually knows what they're talking about, is kind of the subtext of some of those things. Um, Maybe would you mind telling us a bit about your book that's coming up, and then also maybe some of the I don't know, maybe like misconceptions or myths, or like maybe just top like couple of messages, if you could get that out into the ether, what or to the masses, what would you relay about hormones in general, please?
Yes, book should be coming out late July, early August. So we're almost there, and it's going to be filled with a lot of practical things that I feel like women, it should be common sense, right? We're not eating out of plastics, we're eating out of glass, but we might not know why and
Mm.
how that affects our hormones. So a lot of environment, a lot of nutrition that is important to hormones, and spiritual. I see in perimenopause. So at my brick and mortar, most of my patients were perimenopausal women. And I would know these women from the community. And you would look at them and think that they had everything together, right? Everything was great. They hold it all together, but really they're struggling inside. And a lot of it is spiritual. I feel like women are spiritually attacked by the enemy. He waits, like a lion ready to prance on us, and waits till we feel alone, till we feel uncomfortable in our bodies, but we're not talking about it with our friends, with our husbands. We're feeling anxious, we're gaining weight out of nowhere, all these perimenopausal changes that we go to our doctor, our conventional medicine doctor, through insurance, and they dismiss it. So then we feel that like fear of rejection come in, and we just feel like, oh my gosh, like I can't talk to anyone about this. So they take the antidepressant or they take the birth control, and then they're just attacked more and more. So I see this over and over again, and I want to change it. I feel like women in the perimenopause space, this is when we hear women, getting divorced, going to try some like new age yoga and like be a yoga instructor. I did that, by the way, so I can talk about that. They just do all these things that are out of character for them, and really self-destructive. And we live in a culture right now where we're like celebrating, women, oh, we're strong, we can do it by ourselves and all this stuff. No, like we're weak, like we're not enough. Like we need Jesus. We need a strong husband. We need a strong marriage. We need to keep our house in order. So I'm really passionate about all that too, because we can have good physical health, but if we don't have good spiritual health, it doesn't work. Like they're connected. And I've seen this like time and time again. So I think that that is something that I'm really passionate about. And there aren't a lot of books or people even speaking about this because they're worried. It sounds different. They don't want to offend anyone. But I just pray that my words are seasoned with salt when I talk about this stuff. And it does speak to women out there that are struggling or feel alone. And then when it comes to hormones, I get so many questions. Do I take bioidentical hormones? And this is not just a yes or no. It's a yes, but it needs to be done properly. Okay. Because like anything, we can overdo it. And if we overdo things, then we push this hormone cascade down a bad pathway. So a big misconception, a big thing that I see is women going to their doctors, they're getting bioidentical hormones, meaning estradiol is estradiol. It's not a conjugated equine estrogen, or CEE, which is birth control pills. Okay, they're getting the actual molecule. Now it's made in a compounding pharmacy, or it could be from a pharmaceutical company in a patch or something, but it looks the same. So when it goes to that receptor, it's doing what it's supposed to do. A lot of the scary literature out there, from the Women's Health Initiative, they were using in those studies conjugated equine estrogen and progestins, which are not bioidentical. Okay, so to clear that up a little bit. So what I see a lot is women go and they get that. Now this is postmenopausal and they're on estrogens, but they're taking it as a patch or a cream, and then they're getting their labs checked serum, so blood testing, and it shows low estrogen still. So then they're put on more. And I've actually seen women, they're on like, 2 milligrams of estradiol twice a day, which is a massive dose, and they don't need to. And then we check their saliva testing, which is a different way of testing. So you can look at the tissue level and we see they're overdosed. So when we're overdosed on hormones, that is when we have an imbalance of estrogen, progesterone are the main ones. And estrogen is going to promote growth and can go down a toxic metabolite pathway, where progesterone can be protective and balance that out. So that's a big thing I see. And it really makes me feel a little bit distraught, because we can do damage with that, and people think they're doing a good thing. Another example of that is pellet therapy. Pellet therapy has gotten really popular, and women are put in perimenopause on massive doses of testosterone. And yes, women need testosterone, but a lot of women, they produce adequate testosterone through menopause. And I'll see this when I test and do saliva testing and blood testing for testosterone. Now, these pellets are doing super therapeutic things in the body. So if you put, if I went and got a testosterone pellet, tomorrow, I would feel amazing. It's like a high. A testosterone is a controlled drug. We can only prescribe it 6 months at a time, because it's a controlled drug. I mean, it gives you like that high. I've never been overdosed on testosterone, but I've talked to women that have been, and they feel so good for a couple months. So they tell all their friends to go get testosterone pellets. And then what happens? They crash, because our body freaks out and is like, this is way too much. This is super therapeutic. And then the other concern, if we have any hormones out of balance to the other ones, we can have consequences like high testosterone with low estradiol can produce cardiac effects and increase risk for cardiovascular disease. So all these things need to be in balance. So I think women, when you have the knowledge, you can ask the right questions, you can get the right care from the right provider, and work as a partnership. And then the benefits outweigh the risks for hormone therapy.
As far as like when you're working with folks who are using bioidentical hormones, which sounds like it's a very large part of what you do, um, you mentioned about salivary testing. Could you speak to why the salivary testing would be more useful to track patient levels or progress or whatnot versus, say, serum testing?
Yeah. So when you look at saliva testing, it is going to be looking at the tissue levels. Okay. And they've done studies on this where that saliva represents the tissue level, where serum levels are not going to represent that. So if you're putting something on topically, you're not going to see it in the serum. You're going to see it more in the saliva and the tissue levels. The only cons for saliva testing would be if you're taking a troche, and the troche is something that is put inside the mouth, and you have it sublingually, so it's absorbed through the saliva, and they say it doesn't go, you don't swallow it, and doesn't go through first pass through the liver. But we know that some people get impatient and they swallow it, and you are swallowing some of it. So for me, troche isn't as safe as topical application of estradiol and testosterone, because you're getting that first pass through the liver. And the concern for the first pass through the liver is going to be the concern of those toxic metabolites.
And on the topic of metabolites, like some tests out there, like say the Dutch test or some other companies, like I think Doctors Data, maybe Genova, and different companies offer these urinary profiles where you can look at the levels of different, say, estrogen metabolites. Is that something that, and just where some of those are, some of those metabolites seem to be associated with better health outcomes versus, not so good health outcomes. Is that something that you recommend and for your patients? Is that important to look at those metabolite levels?
Yeah, I do think that women should at least once look at an estrogen metabolism test. The only downside is it's a little bit pricey and it's not covered by insurance. But
Mm.
if you get one of those tests, you can see if you go down the good, the bad, or the ugly pathway. So we have these different metabolites, how we metabolize estrogen through the liver, and then through phase one and phase two detoxification. And then we also have detoxification through the gut. So the concern is sometimes phase one, which is mostly liver metabolites, if it doesn't have the right cofactors or genetically you can't push that phase one pathway, you don't have cofactors, you don't have B vitamins, that could slow things up. Sometimes you can have them stuck in the middle of the metabolites and they're not going through phase two, which is more things like tagging the estrogen metabolites and taking them out. So this is where like glutathione and NAC would play a role. So there's different ways that it can get stuck. And if we have these toxic metabolites, they can lead to DNA damage versus DNA repair. So it's 2-methoxy, 4-methoxy, and 16-hydroxy that are the different pathways that we look at from these urine metabolites. And this is really helpful when it comes to focusing on how we metabolize our estrogens, not as helpful in dosing. Because if we were dosing off this urine metabolites, that would not be as helpful because we're looking at what is left, not what is in the tissue level, not which is binding the receptors. So that's where this can kind of get confusing because some people are dosing off of urine metabolites and only dosing off urine metabolites. Urine metabolites should be used as like another tool and to look at how we're really breaking down estrogen in our body and how we could mitigate negative breakdown of estrogen. And that's where you look at things like liver support, supporting the liver with cofactors, things like milk thistle, artichoke root, dandelion root, all of those things to support our liver health. And then that supports that phase one, also broccoli sprouts or I3C dim. And then we look at phase two, where really glutathione and NAC supplements can come into play. So NAC is converted to glutathione in most people. Some people don't convert it as well and just need the glutathione. So this is where you're working with someone and you can look at these results and say, yeah, we need to give you more support and make sure that your estrogen is going down the good pathways. And then also, if we see someone in there genetically, they go down that bad pathway, well, maybe you talk to them about, we really need to avoid endocrine disruptors. So anything that is going to disrupt that estrogen receptor, things like plastics, things like phthalates, parabens. So that's anything that has fragrance in it could be a problem. Alcohol, this is what broke my heart. I don't know if you saw this, Brian, but alcohol during the pandemic, it was like the cool thing to do. So I was in Ohio at the time where Ohio is just really gray in general. So people, their immune system is busted during the winter. Their mood is busted. It's not good. Their vitamin D is low, so their immune system's low. So then everyone was doing and taking pictures and putting on their social media of this wine down with DeWine or wine with DeWine, where they would watch, him addressing the state, which, was all negative and fear-based, propaganda, all of it was. And then they were drinking their wine during it. And I'm like, oh my goodness, if you wanted to do anything for your immune system, you would not drink alcohol and especially sugar alcohol.
Mm.
But also, we're impacting how estrogen is broken down, right?
Mm.
And that concerns me with looking at breast cancer because we know cancer is a breakdown of our immune system too. So alcohol, the pandemic, all this stuff. I mean, I haven't looked or I don't think anyone's researching this, but I bet you breast cancer is going up and they're going to blame it on, oh, no one was getting mammograms during the pandemic. No, we literally, we're letting fear creep in. Our immune system was down. We weren't social around people. And then alcohol sales went up and people would get takeout all the time. So it's like, all these things, they all play a role, and it's not to stress anyone out. and think you're doing it wrong. It's just so you're aware, so you can start doing little bits at a time for your health to prevent disease.
I think you kind of alluded to this, but that just making that, I think, so folks have the information so they can make an informed decision. And if you know that you are, bless you, if you know that are like, I'm gonna eat fast food all the time, and it's
Thank
like,
you.
hey, as long as you know that, okay, that's probably not going to be good for your long-term health outcomes, so you choose to do it anyways, well, that's your business. But I think a lot of folks just don't know. And like even around alcohol, especially things like red wine, it's like, I remember years and years ago, it was like lots of newspaper articles like, oh, red wine's good for you, it reduces your risk of this and that. But it's like, yeah, but then when you control for the alcohol components, like at least I know here in Canada, at least, now like the recommendations are like for women in particular to have like, not more than like, I think one drink a week or something like that. Like anything above that is like, it will increase your risk of breast cancer, maybe other cancers as well. So, I think there's just, but then not everybody got that memo. So yeah, it's just, having these conversations is important so folks can like learn about what's the most updated understanding of things. Then, you make your decisions from there. Um, I was wondering around the just metabolism, the hormone metabolism again. You mentioned a bunch of different cofactors for, phase one and phase two, which is great. I'm just wondering if you think it's important to know about a patient's overall methylation status, like, whether doing a genomic profile to see like how their various methylation genes are looking, or, doing like a serum test to look at methylation cycle metabol or component levels are looking like. Is that something that you look into, or not super important in your experience?
Uh, I Yes and no. This one's tough because there are a lot of different genomic tests out there, and you'll have to comment on which ones you use. I like there's a new one, Intellex. It's a DNA test, and it looks like at all these different cofactors, right? Some people, when 23andMe was big, you could get that, and then you could look at all of your SNPs, or single nucleotide polymorphisms. And what these SNPs mean is that you have these cofactors. So these cofactors, like MTHFR is a big one, it helps move this pathway of methylation. Okay. And if you have a SNP, or this, basically genetic polymorphism, it's going to slow it down. Okay. So say someone their genes are great, they're operating at 100%. If you have an MTHFR mutation in one of those SNPs, you might operate like 10 or 20% less. I think that some people, they find out they have MTHFR methylation issues, and they're like, oh my goodness, I'm such a poor methylator and all of this. And it's almost like a medical like hex or curse. I think that most of us, and if you look at the data, most of us do have some sort of MTHFR SNP. We do, and that affects our methylation. But some people are really poor methylators. So I think this is important. And I have done this in a few patients where their kids, unfortunately, like they were going through a separation and their kids hadn't had any jabs. And then all of a sudden, the other party was like, I want them caught up to date, right? And so we ordered a methylation panel, to see how they're methylating, what's their MTHFR, what's their COMT, all of the different ones that help process toxins and get them out. And then I left it to the pediatrician, like, here, you need to look at this because you probably shouldn't do a catch up in a year for all of these. And we do know that some people, I like to think of two garbage bins. Some people, their garbage bin gets to the top and they take their trash out, and they're good at emptying that trash. But then you have some people where their trash gets so full, but they can't empty it as fast. So it overflows. And that overflowing is symptoms. That's PANS-PANDAS, that's autism, that's migraines, that's poor gut health. So it's all these different symptoms spill out, but we're not looking at that root cause. So getting those genetic markers can help, but I have seen people where they're like, "Oh, I'm just such a bad methylator and there's nothing I can do." And like, no, no, no. You didn't know that piece of information. Think of it as empowering and you're going to make better choices. Like we were talking about earlier, you're not going to drink a bunch of alcohol every night. You're not going to have a glass of wine to go to bed. You're going to make sure you eat nutrient dense foods from local farms and not stuff that was picked 3 weeks ago and doesn't have any nutritional value and it's coming to your grocery store. You're also going to, unfortunately, have to take supplements. I do feel that we lack nutrients so much in our food anymore because of the soil quality. And Joel Salatin talks a lot about this. I just heard him speak, and our soil is just so devoid of nutrients and minerals. So the broccoli that we're eating today is not like the broccoli my parents had when they're growing up. So we do need to layer in some thoughtful supplements into our plan to make up for that, to fill the gaps. So then if we have these methylation SNPs or deficits, if we can't methylate as well, that we're giving the cofactors needed. So even though we're not operating at 100%, we're operating a strong 80%. So I mean, it can get confusing out there. And I really suggest, if you are going and getting some of those panels, that you're working with a doctor that reads those panels, that has taken courses on the panels and know how to guide you and what to focus on and maybe what you could focus on later or it's not important, right? And it's almost like a triage. And I think with functional and integrative medicine, you need to have someone that has a gestalt or this experience that they can really point you in the direction of, this is what you need to focus on now. We'll bring this in later, or we're going to do baby steps, because I know from experience, if you get overwhelmed, if I overwhelm you and tell you too much to do at once, you will do nothing, because that happens a lot too.
Yeah, it's really well said. And even earlier today, I was chatting with a patient from out of province, and he was asking me about like, well, when do we do the heavy metal detox? When do we like start working on immunotherapy? This and that. It's like, okay, like I just recommended like four supplements for you to start on to like just obliterate these microbes that we know are in your gut right now. Like we're going to work on that, and then it's going to be the next step and the next step. But like it's just it's just information overload, especially for folks who are
Yeah.
thoughtful, they're intelligent, they're reading, they're researching, they've maybe been gaslit over the course of time by different medical providers. Like I have to take my health in my own hands, and like I applaud them and commend them so much for that. And that's probably what brought them to my doorstep or your doorstep in the first place. But then, at the same time, like we need to have like a reasonable roadmap moving forward and being kind of discerning. So I like that Gestalt reference there. That's very brilliant. I would like to talk to you about a couple of other topics, just because I know we've only got so much time and we've spent a lot of time on hormones here. So if you don't mind, I'm gonna just pivot a little bit here, because I did want to talk to you about peptides, and I'd like to talk to you a bit about the carnivore diet as well. Maybe as a quasi, well, maybe not even so quasi, but a bit of a segue question that's still kind of hormony because it is, but kind of getting into carnivore. You had a post on Instagram a little while ago, and it was about natural methods to help boost up your GLP-1 level. GLP-1 for listeners is glucagon-like peptide. Folks out there have no doubt heard about drugs like Ozempic and the other versions of semaglutide. And while those medications or those peptides can be very positive for some folks, maybe it's a bit of a double-edged sword sometimes. So could you comment on, please, natural ways to boost up GLP-1, and then maybe segue that into carnivore diet, meats helpful and important, and maybe any thoughts about semaglutide injections if you want to work that in there, if you have an opinion to share.
Yeah. Oh, yeah. I always have opinions. Um, yeah. So GLP-1s, uh, you know, I I was using them in my practice, and my colleagues were from a compounding pharmacy before the Kardashians made them popular. And I remember, though, I made a rookie mistake like 5 years ago when I like used it with like the first one of the first few patients. And I didn't emphasize with her the need for protein and lifting weights. And she lost a lot of weight, but she did lose some muscle. And then shortly after that, the studies came in that showed that we are seeing more muscle loss with this. And we're going to have muscle loss if we're not triggering use of the muscle and if we're not having adequate protein, because we know muscle, breaks up, builds down. So now when I have patients on GLP-1s, I go low and slow. I don't want them being so nauseous they're not eating. I don't even want it to look like they're taking a GLP-1. I feel like that is shows if you're going to an experienced doctor or not. If you're on a peptide, if you can tell you're on a GLP-1, you're not doing it right. If you're getting like Ozempic face and Ozempic butt and all the things, right? So we want to go low and slow. What we're doing is we are reversing the insulin resistance. And I've seen patients that have literally tried everything with the exception of stress. Okay. And this is where I work with so many perimenopausal women. They are so stressed out. They're so stressed that it's basically triggering insulin resistance in so many of these women, and they have a lot of trauma that they're not dealing with. And this is where the spiritual part comes in, and they need to give control to God and pray and just give it all to God, because coming from a recovering type A personality, which I'm still a little type A, but I'm trying to recover. But I thought I was like in control of things. Like I'm not in control of things. So finally I gave that control to God, and I feel like my sympathetic and parasympathetic system is more balanced. Except actually just last night, I don't know if any of your listeners can relate to this, but literally like 2 out of my 3 boys are just just like screaming. They're just so loud. And I'm like, and I dropped a dish with like butter in it because I just was startled. And I'm just like, because I've been homeschooling them and it's a lot. So I went and I did my vagal nerve stimulator, and I just told them, I'm like, I need you guys to just not yell all the time. So we need to know our boundaries of stress, because I know when I'm stressed, that is going to be catabolic. That's going to break down muscle. That's going to make me insulin resistant. That's going to have me crave sugar, and all of these things that are bad. So women, when they have this stress, they are going to get insulin resistant, and they're going to try to work out, and they're going to try to diet. We check their fasting insulin. It's high. We check a continuous glucose monitor. It's not good. Now, sometimes we can naturally stimulate their GLP-1s. We can help reverse insulin resistance, have them lift weights, have them fast. So fasting helps increase GLP-1. There's different things we can do. We could give Anchormansia, which is a probiotic strain that does help increase GLP-1. So we can try these things, and sometimes fixing the gut, giving more Anchormansia, which with leaky gut, Anchormansia is low. It is a mucin-loving, mucin-producing bacteria. And if it's low in our gut, it's hard to get up. Before the actual probiotic strain came out, because we didn't have it for a while, we just had to give prebiotic foods to feed what was in there of the Anchormansia. But now we do have a probiotic. So you could try those different things, but sometimes I will have women and we will go low. Sometimes we'll do a microdose to decrease the inflammation, to increase the GLP-1, to help the GLP-1, go in the brain and bind in receptors in the brain. We know it's helpful with the brain too. Really decreasing inflammation also. Now, the side effects that I see are when it's dosed too high. So when it's dosed too high, you're so nauseous, you can't drink anything. So you could end up in the hospital for electrolyte abnormalities and kidney problems. So some acute kidney failure, that's happened before. If you're getting it from a place that is not appropriate, or not a compounding pharmacy that is regulated, because they can be regulated or not. If you're not getting it from a good source, you could get pancreatitis. You can get all these different side effects that's happened. I was talking to my compounding pharmacist about that. She's heard those stories. If you are on too high of a dose and you're so nauseous and you're not eating, you're going to lose muscle mass. And if you're on that high dose, you're going to get constipated and possibly even gastroparesis, which is when the stomach basically gets paralyzed and doesn't function well. So these side effects I see more at really high doses. So if we start at lower doses and I try to have patients on it a few months and then they're off or take a break, or we go down to the microdosing if they think that it's really helping for their inflammation, which I see a lot. And then we look at pros and cons because there's other things like low dose naltrexone we can use for inflammation instead. So we leave it up to the patient and how they do. But I've seen it really help women in perimenopause if they are hitting the protein and the weights. And I tell them, I want you to eat 30 grams of protein with each meal. I want you to hit 120 to 150 goal of protein. Make sure it's good animal-based protein with leucine because we need leucine to trigger that muscle growth. And then lifting weights, at least 3 times a week. 4 would be best. They can add some creatine in there. Another peptide that I will stack with the GLP-1 is a plant-based peptide called Peptistrong, and it's from a fava bean. And this is coming from Nutrivus, which is in Ireland, and they're looking at plants and deriving peptides from plants. And this one's studied for maintaining muscle mass. So that's that Peptistrong, and it's in a few commercial products out there. So that one pairs nicely with the GLP-1. If you don't mind giving yourself more injections, you could do a growth hormone secretagogue that pairs well with a GLP-1 because the growth hormone secretagogue, dose it at night on an empty stomach. You can do a dose also during the day, but most just do it at night. Help secrete your own natural growth hormone, and that will help support muscle mass while you're on a GLP-1. So there's different things to do. I think I saw a statistic that like 1 in 3 Americans have tried or been on a GLP-1. So as yeah, so right. And they're not talking about now. I can tell, I don't know about you, Brian, but like if I'm on someone's Facebook and all of a sudden they lost like 50 pounds and they just look like they don't have muscle mass, I'm like, oh, they were on a GLP-1, but not the right way. And that's scary. That's scary for women because after age of 40, we're losing 1 to 2% of our muscle mass a year. And it's harder to gain muscle as you age. So that's like the word that's like not anti-aging, that's like pro-aging. So if 1 in 3 people have tried it or are on it, shouldn't we know how to do it the right way and make sure that we're using this as a tool, but also using the right tool for what we want it to do? So I think that with that peptide in particular, I'm not polarized like it's good, it's bad. It's good, but it can be bad. So we have to be good stewards of it, like anything in medicine.
It's really, really well said. I'm just curious, you mentioned that fasting was one way that we can naturally boost up our GLP-1 levels. Are we talking like intermittent fasting? Are we talking like a 3-day water fast? Like what kind of fasting would you be generally talking about with your patients to help with that?
For women, I usually recommend for fat loss the 36-hour fast. So men could do it whenever. Women that are premenopausal, I would want them to fast in that follicular phase the first 2 weeks of their cycle. I don't like women to do really long fasts the second half because it can stress out their body. I want to preserve progesterone. I don't want them to be stressed. So I would say 36-hour fast for weight loss is what I'd usually recommend. And then have that in the first 2 weeks of their cycle. And it would be a water fast. But when I have patients fast, I'm like, have electrolytes, just test the electrolytes with a continuous glucose monitor, make sure it's not raising your blood sugar.
Mhm. And since we've talked about couple of peptides there, are there other peptides, like say outside of the weight loss realm that you work with on the regular?
Yeah, I love BPC 157. Right now, it's not available for injection, but it is available oral and really great for gut health and inflammation. The injectable is really great for tendon health and just injury. I missed that one. And compounding pharmacists are being creative and coming up with one similar to that would do the same thing. But for now, oral BPC 157 is really helpful. I like to pair that with KPV. KPV is great for inflammation and also good for gut health. KPV also, I really like using it with patients that have mold going on or in like sears going on that have a lot of inflammation. It can really calm that down. So those are two oral peptides that are really nice ones. Another peptide I like, PT 141. This would be great for women and men, women in perimenopause, women in menopause, any woman that is like stressed, so they don't have a libido, right? And it's interesting because a lot of the time I'll check women's hormones and their testosterone's fine. Like every woman wants to blame their low sex drive on testosterone. And I'm like, well, like the labs just don't show that because it's stress. Like a big cause of low libido is stress. And we work on that with adaptogens, of course, and stress modification, behavior techniques. But PT 141 with a little oxytocin, you can get that mixed up at a compounding pharmacy and it's intranasal 30 minutes prior to, activities. And that can really help. So that's another peptide that's a good one for listeners, and men can use it too.
I know here in Canada, our access to peptides is abysmally bad, but is that one just for US listeners? Is that one still available to you folks?
Yes, it is.
Okay,
Mhm.
cool, cool. Um, and then I know we don't have a ton of time left, but just wondering if we could talk a little bit about carnivore diet. I know you've posted about the importance of meat, and you've talked about the carnivore diet. Uh, do you yourself follow a carnivore diet? Do you prescribe it? More of a meat-based diet? What are your thoughts about meat and eating?
Yes, I love meat. I have graduated from just liking lean cuts of filet, right? From when I was little, and now I love a good ribeye. It's my favorite cut. Have a lot of fat, but you want to make sure it's grass-fed, and grass-fed, grass-finished would be best because you're eating the fat of an animal. You don't want them eating a bunch of grain that is GMO and probably have mold in it. You don't want that. So you really want to know your farmer and have grass fed. So local farmers best. If you can't, then get grass fed, grass finished. So that's going to be best. Meat is just, especially red meat, it's very nutrient dense. You're getting a lot of B vitamins. If you can mix in organ meat, that would be great too. You're getting a lot of leucine in there, which is great to trigger muscles, and you're getting a little bit of creatine in there, which is great for muscle. So I really think that meat could be healing. I think that you need to check labs. If you're going to, I'm just starting carnivore today, I think you should check some labs and see what's going on if you're going to commit to that 100%. I am more of an animal-based diet. I will cycle carnivore or maybe do 3-day sardine or carnivore bar challenges if I feel like I've just been off track. So you just need to listen to your body with that. I will prescribe the carnivore diet to patients. And one of my favorite patients to prescribe this to is pregnant women. So I'll be working with a woman on gut health or like a mysterious rash, because I have a few coming to mind of these patients, and they'll get pregnant and they're like, well, now what do I do? Well, I assure them that during pregnancy, most autoimmune diseases calm down, but they do flare up post-pregnancy. So we still want to keep an eye on what's going on. So I will prescribe the carnivore diet, especially if they have some sort of gut dysbiosis or imbalance, because the carnivore diet, and there's studies that show this, it can change the presentation of the microbiome and basically the gut bugs in the gut. So I have gotten good results with patients with this. I have another case that comes to mind that this this guy, he had a lot of anxiety, like really bad anxiety, had some like bipolar stuff going on. And I'm like, I really think this is your gut health. So while we're waiting on some testing, I want you to just go carnivore for 2 weeks. And the changes were amazing. He was just getting nutrient dense food. He wasn't getting fast food. He did a lot better. And we found out it was a mold exposure that triggered all of that. that gut brain connection. Yeah, it was kind of crazy to see, like all of these mental health disorders, they all have a root cause. They're all symptoms. Like I always say, anxiety is a symptom, it's not a diagnosis. But a lot of people, and there's a lot of influencers that have embraced the carnivore diet, and they've had acne and it went away, because it's all our gut health. And if we're eating processed food, or whatever breads and all this stuff, it really does affect our health. So the carnivore diet basically takes out all that crap, right? It takes out all the breads, all the snacks, all the cookies, and you're just eating whole foods. So that's why I like more animal based, because I do think there are some vegetables like broccoli sprouts that has, a lot um, of those good nutrients in it that help detoxify estrogen. So I think that those are helpful. But I also think there are some plants that have a lot of oxalates and can do harm, like spinach. So I remember, and I was joking with my kids about this. I'm like, remember when I used to make smoothies and I would put in like handfuls of spinach, like this is like 10 years ago, and they're like laughing and they're like, yeah. And I'm like, yeah, like now I think oxalates are poison because I know more. So it's that knowledge that, there are certain vegetables that have anti-nutrients and have oxalates, which can cause kidney stones and make sharp oxalate crystals in your body that can cause problems. And we want to do better. So I think carnivore just eliminates a lot of that. And because if you're doing carnivore with a lot of fatty cuts, and that's where seasoned carnivore people will tell you, you do need that fat to really, stay so you're not hungry. If you're just eating chicken breasts all day long, that's not going to work for a carnivore diet. It's really more of like almost a keto diet, because you're having the higher fats and then you're staying satisfied and you're in this nice ketosis state, burning fat for energy.
Yeah, I've seen a lot of benefits to the carnivore diet, and I kind of view it in my mind as being like the ultimate hypoallergenic diet. Because if you look at any food sensitivity out there, it's pretty unheard of unless you have like an alpha gal intolerance or something. You're
Oh,
not going to react
yeah.
to meat, right? So it's like the
Don't
ultimate.
get me don't get me started on alpha gal. I think that is some big conspiracy thing going
Oh,
on.
okay. Oh man, I haven't heard that one. Okay.
Well, okay, I mean, I'm just saying something's off with it. And I was talking to someone that owned a farm in Middle Tennessee, and she said last year she didn't see any Lone Star ticks. And Lone Star ticks got their name from because they're from Texas. And now, like she said, she went to milk her cow and her cow's udder was just filled with Lone Star. And I'm like, is someone like dropping these off? Like that seems a little odd. And then there's a lot of alpha gal around here. So
Hmm.
it's very strange to me. And I don't want it to be true that someone is planning these around. But yeah, gosh, last night I think we pulled like 10 Lone Star ticks off our Sphinx cats because they just get on there. But yeah, it's something. That doesn't seem like a normal migration, right?
Hmm. Yeah, I don't know anything about it, but that's interesting.
Well, hopefully Canada doesn't get them.
I hope so too.
It's
We're
a
pretty
long
far
and
from
it's too
Texas.
cold. What?
Well, we have lots of ticks up here, unfortunately, but yeah, no Lone Star ticks, anyways, that I know of. Lots of other ticks. We're yeah out here in Nova Scotia. We're the Lyme disease capital of Canada, so we have plenty of
You
ticks.
are.
We are, yeah,
Oh
we're pretty close to
no.
that Lyme, Connecticut, so not too far geographically from there. The one last question I'll ask you, if you don't mind, Dr. Jen, just before we wrap up here. Um, uh, as far as the labs that you recommend that folks get drawn up before, say starting a carnivore diet, I mean, in my experience, like really the only um, bad labs, and I kind of say bad in quotes because I think it's a highly debatable topic. But the only like sort of quote unquote bad things that I might see is cholesterol levels going up, and then usually like otherwise everything else just looks better than ever when folks go carnivore, assuming they're doing it in like a good responsible way. Is it mostly lipids that you're thinking about, or like what are the labs that you'd be concerned about looking wonky if a patient's doing carnivore?
Yeah, I would get lipids and I would make sure that they don't have a familial hyperlipidemia because you don't want to push that too much. But when we look at high cholesterol, it's not the high cholesterol that's the problem, it's the inflammatory markers. So then you would want to check a C-reactive protein and you could do an extended lipid panel too and see maybe their ratios of ApoA and ApoB, lipoprotein little a, and then MPO. And MPO is a marker of like fluffy inflammation in the vessel. So I think that's the concern because cholesterol is needed to make hormones and it's not always bad, but just make sure that you're not catching someone that just has a genetic, predisposition to that, right? Because I mean, I do think that there's probably people out there that do not thrive with a fully high fat carnivore diet because we're not all made the same. And same with I think there's probably like 1% of people that thrive on a vegan diet. Only 1% though. But do you know what I mean? I think that we do still need to be like prudent with like making sure that we do go back to science and check some labs. So say their cholesterol does increase on carnivore, but everything else gets better and their C-reactive protein is low and overall inflammatory burden is low, then that's great. The problem with a lot of red meat is people aren't just eating red meat, they're eating red meat with French fries and seed oils and buns and a milkshake.
Mhm.
And that's where eating red meat gets a bad name and even carnivore. So I think that those labs, like I agree, I think overall inflammation and disease burden goes down, but just to catch a few of those outliers and to show that, yes, they might have high cholesterol, but their inflammation is low. And cholesterol doesn't cause heart disease, but inflammation with high cholesterol does.
My understanding as well. Thanks for commenting on that.
Of
Well,
course.
Dr. Jen, I know we're kind of winding down on our time here. Just before we wrap up, would you mind just sharing with folks, maybe the name of your upcoming book, where they can find you on social media, if they want to work with you, how do folks work with you, and anything else you want to share, please?
Yes, of course. So I hang out mostly on Instagram. It's integrative Dr. Mom. And I also have a podcast. So if you're interested in laughing about our mini farm, I'm doing a lot of vlogs on our mini farm. And it's actually hilarious. Like right now, we have this chicken that's dizzy. We call her Dizzy. I need to get her some electrolytes this morning. So I have that on YouTube. And then if you're interested in the book for perimenopause, it will be available on Amazon and Barnes and Nobles in the summer. So we're hoping late July. And for updates on that, go to my website, healthybydrjen.com. And also on Instagram, I'll be talking about it. So super excited to share that with everyone.
Awesome. Well, I'll post the links to those resources in the show notes. And thanks so much for taking the time to chat with me today. It was been a pleasure. And yeah, thanks so much.
Thank you for having me.
And thanks to everyone for listening to or viewing this episode of the Overcoming Chronic Illness podcast. We hope you enjoyed it, and please stay tuned for the next one.